Can you tell us what's happening here today?
Yeah, so today we are having a rapid testing event here at Cunningham Elementary. We have 3 other rapid testing locations that are happening right now at Ellison Elementary, Blazier Elementary, and Wooldridge Elementary.
You no problem with KVUE.
Are you guys planning to hold any more testing events throughout the year like this?
Yeah, so we are open to doing it. It really just depends on the resources that we need and what families need, but we are ready to meet the need if it arises.
CBS Austin?
Could you give us an idea of what you'll be doing for the first week of school and how the town's going to do it?
Yeah, absolutely. So, we have a lot of our COVID safety protocols in place, and one of them is rapid testing. So, that will be available in the health rooms for students and staff, especially prioritizing those that may be symptomatic. And so, we also will be advertising community resources as well for families who may need testing during the first week of school.
Fox?
And, just to clear up, there's a lot of confusion, masks are still required in the ISD schools, right?
Yes, we will be requiring masks at this time.
Okay, and what was the reason behind that?
So right now we're just looking at our local COVID climate, and so we are in stage 5. That is what Austin Public Health is recommending, as well as our other health and medical professionals. And we are wanting to keep our schools safe, and we know that masks work, so we will be requiring them right now while we're in stage 5.
Thanks, Dan. We'll go around KVUE.
What do you guys plan to do if a student doesn't want to wear a mask or their parent doesn't send them with?
So we will have masks readily available for anybody that accesses ISD grounds. We have tons of masks ready. For those that are not wanting to wear a mask, we really will be working with those students and with those families, and just getting down to kind of the root to it, and seeing how we can work with those families.
Why are you doing this kind of event today so quickly?
Yeah, absolutely. So we know right now that our cases have risen in Austin, Travis County while we're in stage 5. And so, we want to make sure that this testing resource is available. We strategically prioritized schools that were in COVID hotspots to make this available for those students and staff before school starts.
Fox 7?
You talked about, if the students are not, the parents don't want them to wear a mask. If they're really stern on that, what's the ultimate option? Maybe put them virtual. Is there a virtual option still for that?
So I think we'll handle that on a case-by-case basis. And again, it really just depends on the school and the needs of the student and the family.
Thanks, Dan.
And can you re-emphasize what the goal is by having this kind of testing?
Yeah, so, rapid testing is a really great screening tool. Again, we know that cases have risen, and so we wanted to make this resource available for our students and staff in COVID hotspot areas. And then we're able to provide support to those students and those families.
We'll go for one last round of questions if there are any. KVUE?
So obviously kids under 12 still can't get vaccinated. Can you just elaborate on the different safety measures you guys are taking within the school?
Yeah, absolutely. So we are requiring masking, which we know is very effective. We are continuing our vaccine clinic efforts. I know that they're not available to those, under the age of 12, but it is available to their family members and other students and staff that are above the age of 12. We will have plexiglass installed. Seating charts will be throughout the school to help with contact tracing. We do have a public health team here at Austin ISD, which is really unique to a lot of school districts. And so I'm part of that team too. So we process every case individually and do contact tracing and provide support there. And really working for the schools and customizing our approaches, really encouraging outdoor learning and eating. So we have lots of different safety measures in place, hand washing stations, hand sanitizer, and all of that for our students.
CBS?
Yeah, so last year when school started off, we started off with all virtual learning. And arguably, the COVID threat is stronger now versus last.
Hold on, I can't hear you.
Last year, when we started off the school year, we started off with all virtual learning because of the COVID threat. And here we are with the threat, I think, stronger than last year, yet we're doing in-person learning. Do you feel that we've done enough to keep our kids safe?
That's a really good question. So, at this time last year, we didn't know as much as we know this year, right? And so now we know what works. We know that wearing a mask works. We know that vaccines work. We know that washing your hands works and staying home when you're sick works. And so we are implementing that. We also know that in-person learning is the best option for most of our students. And so we want to make sure that, we balance physical safety as well as mental safety and well-being, and that we're able to provide that resource for our students. And so we're going to continue to implement our COVID measures, which we know work, invite all of our students back so that they can have that in-person learning.
What are the steps? I think you touched on it. What are the steps you're taking to help the students once they test positive here today?
Yeah, so anytime that we have a positive, it goes straight to our COVID response public health team. And again, we process that. So we do contact tracing for every single one of those. We make sure that we do notifications. And if we do have a student test positive, we will be in contact with that campus to be able to provide support to that student and to that family, and to make sure that the student is still able to engage in learning for the first day of school.
And right now, if they test positive, how long is it before they can come back?
We are following CDC guidelines. So if we have a positive, a person has to isolate for 10 days. So after they isolate for 10 days, as long as their symptoms have improved, they're able to return back.
Thanks again. All right. Thank you all for coming.
Thank you.